Thomas sir, STMCA would be to take over the session. Welcome to you, sir.
The next is Athato Vamanavirechnvyapat चिकित्सितं व्याख्यास्यामहे तोरन्दरन्दरिः. In the previous chapter, we have discussed about the Vamana and the Virechana indications. The next is about the complications which are produced due to the Vamana and Virechana. The complications which are produced due to Vamana or Virechana are classified into 15 categories, and they are named as separate entities, and those are वैद्य आतुर निमित्तं वमनं विरेचनं च पञ्चदशधा व्यापद्यते. तत्र वमनस्य अधोगतिः ऊर्ध्वं विरेचनस्य इति पृथक्. सामान्यम् उभयोः सावशेष औषधत्वं, जीर्णौषधत्वं, हीनदोष अपहृतत्वं, वातशूलम्, अयोगो, अतियोगो, जीवादानम्, आध्मानं, परिकर्तिका, परिस्रावः, प्रवाहिका, हृदयोपसरणं, विबन्धः, अङ्गप्रग्रहः इति the 15 types of complications which can occur due to the Vamana Virechana. There, in case of the Vamana, downward movements or antegrade movement of the food, that medicine given resulting in diarrhea, whereas in Virechana, vomiting occurring as a result of the complication. These are two separate issues. Otherwise, the other conditions, they are named in the same names like Savashesha, Oshadha, Jirnashodha. These are, and each of these are detailed, and their treatment also is described as such. Tatra bhuksha pidasya atitishnagneh mrudukoshtasya cha avatiष्ठमानं दुर्वमस्य वा गुणसामान्य भावात् वमनम् अधोगच्छति. तत्र ईप्सितानाम् अनवाप्तिः दोष उत्क्लेशश्च तम् आशु स्नेहयित्वा भूयः तीक्ष्णतैः वामयेत्. In case of Vamana, if the patient is very hungry, where you have not given the prior food earlier, or patient who has very Tikshna, and the patient has a Mrudukoshta, in such conditions, the drug which is given for Vamana, instead of producing the Vamana, it may produce the diarrhea, and it may move downwards and produce the diarrhea. And this has occurred in many patients. I have seen many patients where this has occurred. It's absolutely true. And in such conditions, if the diarrhea occurs, tatra ipsita anavaptihi, the expected clinical results are not seen, and dosha utkleshashta, the conditions of the dosha would be worsening. In such conditions, again the patient has to be given snehana, and a Vamana aushadhi which is more powerful, more potent, has to be given. This is not a very rare event. This occurs quite frequently. And if it is not handled properly, if it results in the same conditions further, then there can be more complications. Of course, a number of patients may have a perfect clinical signs of a Samyak Vamana, but later on the next day they may have one or two loose stools. That's not to be considered as the Vyapat. Only when the patient doesn't result in Vamana at all, the medicine doesn't result in the Vamana at all, but results in the diarrhea, then it has to be considered as a Vyapat. Then aparishuddha amashayasya utklishta shreshmanaha sashesha annasya va ahrudyam atiprabhutam va virechanam pitam urdhvam gacchati tatra ipsita anavaptihi dosha utkleshascha tatra ashuddha amashayam ulbana shleshmanam ashvamayitva bhuyah tikshnaterihi virecayet आमान्वये तो आमवत् संविधानम् अहृद्ये अतिप्रभूते हृद्यं प्रमाणयुक्तं च अत ऊर्ध्वम् उत्तिष्ठति औषधे न तृतीयं पायेत ततस्तु एनं मधुघृतपाणितयुक्तैः लेहैः विरेचयेत. Now, in case of the Virechana also, the complications of that retrograde or the opposite effects may occur in the patients who have not clear amashaya. The amashaya is not clean properly. That's the Agni Sandakshana is not done properly, or the patient who has aggravation of the kapha, and if there is resulting in or residual food left over in the stomach, or ahrudyam, if the drug given, Virechana drug given is not really liked by the patient, simply dislike of the patient, or given in excess, Virechana dravya given in excess, it may produce vomiting, it may induce vomiting, and in that condition too, ipsita anavaptihi doshotleshascha. Now, the point is, as per these texts, like the Virechana has to be given in empty stomach, but practically what I have observed is, Virechana given in empty stomach often can result in more griping pain, and instead Virechana, if it is given after some light food like ganji, that is better accepted, and there should be some 10 to 15 minutes gap between the food and the Virechana Dravya. And the Virechana Dravya should be having some acceptable taste. From that point of view, Trivurt Leha is much better than any of the other Virechana Dravya. Particularly if you give Tikshna Virechana like Ichhapeti, if you give in empty stomach, the griping pain could be quite severe, and many of the patients may have an unacceptable results. And that's why in my practice I usually advise the patients to have some light food like ganji and then the Virechana is given, though the theory would say the other way. Anyway, but it can be, but virtually it doesn't result in vomiting as such. Tata ashuddha amashaya ulbanashleşmanam ashwamekra. In such conditions, suppose the patient has a vomiting, the better treatment is you induce the vomiting further, ensure that the stomach is emptied, and then again administer the Virechana, which is somewhat more Tikshna than the otherwise. And if the patient has the Ama Lakshana persisting, then you have to give Deepana Aushadhis, and then again the treatment has to be given. If the Vamana has occurred, vomiting has occurred due to a disliked material, disliked drug given, that the patient's unacceptable taste as such, and that has resulted in the this MSH vomiting, then you have to change the drug which would be liked by the person. And suppose your second attempt also fails to produce the results, don't give the third Virechana Dravya. Another third episode of Virechana is not to be given. Instead, that patient has to be given a Mridu Leha Virechana or Mridu Virechana with the Madhu, Grita, Pranita, etc. That would be better than the Virechana Aushadhis. Dosha Vigratitam Alpam Aushadam Avasthitam Urdhvagikam Urdhvagi Kramadho Urdhvagi then Adhobhagikam Va Urdhvagikam Adhobhagikam Va Nasramseti Doshan Tatra Trishna Pashishulam Chardhi Murcha Parvabhedaha Hirlaso Aratihi Udgara Vishuddhishcha Bhavati Tam Ushnabhi Adhi Vashvamed Urdhvagike अधोभागिके पीड़ा सावशेष औषधम अति प्रधावित दोषम अति बलम असम्यक विलिप्त लक्षणम अपि एवं वामेत. The dosha aushadhi can remain as such, the medicine can remain as such without producing the expected result of either the Virechana or the Vamana. In such conditions, and the reason is either the quantity of the drug given is lesser than optimum, or the quality of the drug also is not optimum. In that condition, either the Virechana or the Vamana may not occur. In such conditions, the patient may have pain in the abdomen and vomiting also. Vomiting in case of this Virechana Dravya, or the other way, Murcha, even impaired consciousness and discomfort in the abdomen, resulting in a lot of irritations, and the patient would not have the clinical expected results also. Thirst also would occur. In such conditions, it's better to give another course of Vamana if it is a Vamana preparation. Even in case of Virechana, if the same Savashesha Aushadha occurs, the medicine is not really expelled out completely, then there too the patient may have to be given another course of Vamana. A Vamana Aushadhi has to be given, and that whatever the medicine which is left over has to be extracted out. Of course, this kind of a complication rarely occurs. If you have prepared the patient with samyak snehana, this is not a very frequent way. Then Krurakostasya Atitikshnagneh Alpam Aushadam Alpagunam Va Bhaktarad Pakamupeti Tata Samudirna Doshaha Yathakalam Manishyamanaha Vyadi Brahmam Badavim Shamja Apade Tam Analpam Amandam Aushadam Paye Aushadanja Paye. The patient who have Pluracosta or very severe Agni, or the quantity of medicine given is not enough, or quality of the drug also is not optimum. In such conditions, the medicine given would be digested as it's consumed food, and the patient would never have any of the symptoms, neither that distress of either that preparation for the vomiting or that the diarrhea, and the patient may look otherwise as usual. In such conditions, the doshas would not be expelled out, and hence that produces Vyadhi Vibrama. Vyadhi Vibrama, a abnormal course of the disease. The course of the disease would be altered, and unexpected complications can occur, or it also can reduce the vitality of the patient. And in such conditions, you have to give another dose of the drug, which is of a higher potency, and quantity also should be more. Of course, this kind of a complication can occur when you go on changing the drugs like the Vamanavirechnvyapat and so on. This happens quite frequently. अस्निग्धस्विन्नेन अल्पगुणं वा भेषजम् उपयुक्तम् अल्पान् दोषान् हन्ति तत्र वमने दोषशेषः गौरवम् उत्क्लेशं हृदयाविशुद्धिं व्याधिवृद्धिं च करोति तत्र तं यथायोगं पालयित्वा वामयेत् दृढतरम् विरेचने तु बुधपरिकल्पनम् आत्मानं शिरोगौरवम् अनिस्सरणं च वायोः व्याधिवृद्धिं च करोति तम् उपपाद्य भूयः स्नेहस्वेताभ्यां विरेचयेत् दृढतरं दृढं बहु प्रचलितदोषं मा तृतीये दिवसे अल्पगुणं चेति. Now, if the snehana svedana are not done properly, and the medicine given also is not optimum, quantity as well as the quality also is not optimum, then it results in a partial, the woman or ati ayoga lakshanas could be occurring. Like you may not have the proper signs of samyak woman, or samyak virechana would not occur. If there is a asamyak womana, that the womana has not occurred properly, the complications will be patient would have a sense of heaviness and discomfort, and the chest discomfort in the chest. Disease also may get aggravated. In such conditions, you have to give again snehana, and then again the womana has to be done. Similarly, in the virechana, the patient may have the symptoms of pain in the anus area, distension of the abdomen, headache or heaviness in the head, and the vata vruddhi lakshanas also can occur. There again, the same protocol, snehana svedana has been given, and again the virechana has been given with another option of the drug. अस्निग्ध स्विन्नेन रुक्षौषधम् उपयुक्तम् अब्रह्मचारिणा वा वायुं कोपयति तत्र वायुः प्रकुपितः पार्श्वपृष्ठश्रोणिम् अन्यान् मर्मशूलं मूर्छां भ्रमं मदं संज्ञानाशं च करोति वातशूलम् इत्याचक्षते तम् अभ्यर्ज्य धान्यस्वेदेन स्वेदयित्वा यष्टिमुदकविपक्वेन तैलेन अन्वासयेत्. A vatashula can occur in a patient where the snehana svedana are not done properly, or the patient doesn't follow the restrictions of physical activity during the course of the that preparation for the vamana as well as preparation for the virechana. In both these conditions, the patient has to take moderate rest, and during the snehana, he has to reduce the physical activity. And if it is not reduced properly, and if the patient doesn't take rest as such, it results in vata prakopa. Now, particularly, this happens when the patients go for the Shodhana Chikitsa as OPD treatment. In the OPD protocol, you are given snehana at home, and then the patient is allowed to do all the normal activities. This kind of a complication occurs. So it's always safer to keep the patient under observation during the preparation for the woman or the virechana. Otherwise, these complications tend to occur, and this results in Parshvaprushta Shunim and Marmashula, Manya Marmashula, pain in the back or sides, or maybe in the neck or in the Marma area, or impaired consciousness or can occur, and this is Vatashula. In such conditions, you have to give again a Svedana and Anuvasana. Svedana and Anuvasana has to be treated for the treatment for the Vatashula. स्नेह स्वेदाभ्याम अविभावितं शरीरेण अल्पम औषधम अल्पगुणं वा पीतम ऊर्ध्वम अधो वा नाभ्येति दोषांश्च उत्क्लेश्य तैः सह बलक्षयम् आपादयति तत्र आत्मानं हृदयग्रहः तृष्णा मूर्छा दाहश्च भवति तम् अयोगम् इत्याचक्षते तम् आशु वामयेत् मदनफल लवण अम्बुभिः विरेचयेत् तीक्ष्णतरैः कषायश्च ध्रुवान्तस्य तु संस्पृष्टाः दोषाः व्याप्य शरीरं कंडु श्वयथु कुष्ठ पिडक ज्वर अंगमर्दनिस्तोदनानि कुर्वन्ति ततस्तान् अशेषान् महौषधेन अपहरेत. Now, again, improper preparation of the snehana and svedana, and the drug given also is not of sufficient quantity. It can result in dosha utklesha, but doesn't result in a proper samyak vama lakshana, which is ayoga lakshana. The typical ayoga lakshana would occur. It results in distension of the abdomen, pain in the chest, thirst, impaired consciousness, burning sensation, etc. And the protocol of the treatment in such conditions is again the patient has to be given a Tikshna Vamana, further Vamanadravya or Kashaya has to be given. Now, Durvanta is another of the complications where the Samyak Vamana Lakshana doesn't occur. The patient may have 1 or 2 episodes of vomiting, but all the doshas are not really expelled out, particularly because of the improper dosha utplesha and due to the Snehana Svedana as such. In such conditions, the patient may have a long-term complications of itching, swelling, or the other diseases like Jara, Angamarda, fever or Angamarda, and this occurs quite frequently with the Shodhana. What I have observed is these kinds of complications do occur quite frequently if the Samsarjana Krama is not followed. If the Samsarjana Krama is not followed, after any Shodhana, Vamanavirechnvyapat, patient may have many systemic complications, particularly itching and skin rashes. They are very frequently occurring, and hence that's a very important issue. Of course, Sushuddha has not mentioned the improper Samsarjana Krama as a cause for it, but what I have observed is it is due to the improper Samsarjana Krama. And in such conditions, the treatment would be according to the doshas. You have to select the Aushadhi and treat that condition, as in case of the Kushta. अस्निग्धचिह्नस्य दुर्विरक्तस्य अधोनाभेः स्तब्धपूर्णोदरता शूलं मातपुरीशसङ्गः कण्डु मण्डलप्रादुर्भावो वा भवति तम् आस्थाप्य पुनः संस्नेह्य विरेचयेत् तीक्ष्णेन. If the durvirechana has occurred, that again the virechana is not proper. The patient may have distension of the lower abdomen, pain and constipation. Again, itching is a common thing, and in such conditions you have to give Asthapana, and then again a virechana after snehana has to be done. Nati pravartamane tishtati va dushta samshodhane tat santejanartham ushnodakam payet panitapeishcha parshvodaram upasvedayet tatha pravartante doshaha anupravarteta alpadoshe jirnoshadam bahudosham ahashesham balam cha apeksha bhuyo matram vidadyat. Suppose after giving the Vamanavirechnvyapat, if the Vegas do not occur, if the patient doesn't have the urge for either defecation or vomiting, to stimulate that, you may have to give warm water, or you have to have Svedana, fermentation over the abdominal area with the warm hands, which may stimulate the doshas to get expelled out, or the urge for that natural urges for the virechana may occur. And if it results in a proper sign, that's fine. If it doesn't result in a proper samyak lakshana, then you will have to give another dose of the virechana. Apravarta dosham dasharatra durdhva upasamskrit deham snehasatyabhyam bhuyah shodhayet. If the doshas do not get expelled out, if the improper Vamanavirechnvyapat have occurred, then you have to wait for 10 days, and after 10 days, again you have to go for the snehana and svedana, and the shodhana has to be repeated. Durvirecham asthapya punaha samsnehya virechayet. If the patient is a durvirecha, that's he has a very krura kosta and the virechana is not possible, in such conditions again snehana has to be given and then virechana has to be done. Of course, it is better to have that 10 days gap in such conditions. Shri Bhaya Lobhehi Vegaghata Shilaha Prashaha Sriha Rajasamipasaha Vanijah Shrotriyashcha Bhavanti Tasmat Ete Durvirechyaha. Now, Durvirechya Bahu Atatvat Ateva Tan Atisnigdhan Svedapanan Shoriyeta. The Durvirechya are defined here. Durvirechya, difficult to relate, they are defined in this context, and those are those who have very shy nature, or those who are afraid of the whole procedure, and they are not really very comfortable with the whole procedure of the snehana and svedana. And very specifically, Sushruta mentions Sriha, women, but I think it's not necessary that women, it can occur in men also. Those who are king-like, or Vanijaha, Shotriyashta, businessmen, and these Brahmins who are worshipping like, so they, because they do not have a proper willpower, they are virechyaha. Sushruta says they are bahuvatatvat, because they have high chance of vata aggravation due to their lifestyle. And in such conditions, in such patients, atisnigdhana, the snehana lakshana should be complete, proper, and Svedana also has to be done properly. Then Siddhastinasya Atimatram Ati Mridukosthasya Va Atitikshna Madikam Madaptam Aushadam Atiyogam Kuryat Tatra Vamanatyoge Pittadi Pravurtihi Balaviksaram Saha Patakopascha Bhalavan Bhavati Tam Gatena Abhyadya Avagahya Shitasu Apsu Sharkara Madhumishtrihi Dehi Upachare Yathaswam. In case of the patients where the Snehana Svedana is done in excess and the patient's kostha is mrudu, and if the Vamana should be given is more powerful, it results in Atiyoga. And the features of Atiyoga are there will be excess of Pitta expelled out. The patient may have Vojoksha Visram Salakshana and aggravation of the Vata, and the treatment for such conditions is a Abhyanga with Grita and Avagahana, warm water, or Avagahana with the cold water, and consumption of Panaka, Sharkara Madhumishrihi, or Lehi, Leha, Sharkara Madhumishri, sweet substances are given to make the patient recover from that dehydration symptoms. Now, that's exactly the dehydration symptoms which occur due to the excess. A similar complication occurring in Virechana is Virechana Atiyoge, Kapasya Ati Pravurtihi Uttarakalam Saraktasya Tatrapi Balavisramtah Batakopascha Balavan Bhavati Tam Ati Shitam Bupihi Parishya Avagashava Shitihi Tandulam Bupihi Madhumishrihi Chadayat Pitchavastim Jasmi Duryat Kshira Sarpija Yanam Anavasayat Priyam Vadim Jasmi Tandulamana Papam Prayachet Kshira Rasavasya Anyatarena Bhujayat. In the similar complications can occur in the Virechana also, where there could be excess, and there again there will be dehydration, Balavisramsa, the dehydration and Vatakopa occur. And Srishta suggests that you have to give a cold water bath and consume light food like cold ganji, only that liquid portion of the ganji, or madhumishri, with the madhu, even it may be given till the patient may have a bout of vomiting, or Pitchabasti can be given, and or Anuvasana with the Kshira and Sarpi can be given, and again liquids are given. Of course, in both these complications with the dehydration, now we have more efficient method of IV fluids. IV fluids with the Ringer's lactate is a better option in such excess conditions where the patient may have dehydration. It does occur, though not very frequently, but it can occur quite significantly, and IV fluids may have to be administered in such conditions. Tasmineva Manatiyoge Pravruddhe Shonitam Sthivati Chardayati Tatra Jihvanissaranam Apasaranam Akshnoho Vyavrittihi Hanusamhananam Trishna Hikka Jwaro Vaisanyam Ityupadravaha Bhavanti Tam Ajasrak Chandana Ushira Anjana Rajachurnaihi Sasharkara Udakaihi Mantham Payet Palaraseshva Sadrita Kshaudashakarehi Shringabhirva Vatadina Peyam Siddham Sakshaudram Varchograhi Birva Payasa Jangalasena Bhojet Atisruta Shonita Vidhanyanam Pacharet Jihvam Atisarpitam Katuka Lavana Chuna Pragristam Tila Draksha Pralipam Antapirayat Antapravistayam Amdam Anye Tasipurastat Khadi Vyavarteta Akshini Gradam Bhakti Pirayat Hanusamhanane Vatasteshmaharam Nasyam Svedam Sibidadyat Tishnadishu Yathashwam Pratigurvita Visanye Veena Gatiswanam Shravayat. Another of Vamanati Yoga complications can result in either hematemesis, very serious complications, or the patient may have a persistently protruded tongue or dislocation of the mandible, or patient may even have the improper vision, the eyes will be looking upwards, so that our patient may have thirst or hiccup or jwara, fever also, or impaired consciousness occur. Now, as far as these complications occur, hematemesis is a very critical condition. Hematemesis can occur if a patient has a peptic ulcer history, or a patient who has a varicosities, esophageal varices. In these two conditions, and hence whenever a Vamana is prescribed, you have to be very sure that the patient doesn't have a esophageal varices or peptic ulcer history, and that massive hematemesis can be quite critical in Vamana conditions. That caution has to be taken. Of course, with Virechana, such complications are rare. Virechana is much safer than the Vamana from that point of view. a few drops of blood coming through is not a shown as steamer. Anyway, that's the point there. Or the other complications which are mentioned by Sushruta as a protruded tongue or dislocation of the mandible, it's a very rare situation. I have not come across that complication till now. Impaired consciousness, of course, patients may have that feeling like they are unconscious. They may not. It may not be totally unconsciousness, but patient may have a sort of giddiness as a complication. In such conditions, Sushruta has suggested if there is a massive hematemesis, ajash rakta, the blood of the goats may have to be given, and ajasrata, with that goat's blood with the chandana, mushira, anjana, etc. has to be added, and or sharkarodaka mantha, sharkarodaka, that sharbats have to be given, or palarasa, fruit juices also can be given, or Shringavata, the payas, liquids prepared with the Shringavata would be can be given, and or milk has to be given. So nourishing food has to be given, nourishing liquid food has to be given, or all that protocols which are to be followed in case of excessive bleeding have to be followed. Now, from the current point of view, it goes up to the level of maybe, if necessary, blood transfusion. Then, if there is a protruded tongue, you have to apply some pungent and salty churna, dust over the tongue, and then push the tongue in. Of course, I have not come across such a complication till now. Then, after it has entered in, you have to consume some sour substance in front of it, so that he would have a proper salivation. So, stimulate the salivation. Then, if the eyeballs are protruded, then you have to compress the eyeball, push the eyeball back with the ghrita. Of course, again, I have not come across such a complication till now. Dislocation of the mandible, again, nasya and sweda have to be given. Of course, dislocation of the mandible can occur in any other weak patients also, particularly if the patient is having vomiting, or if the patient has an impaired consciousness or he is restless, then the attention has to be drawn towards the other part, like by exposing him to some music of different sorts. Similarly, a similar atiyoga in Virechana atiyoge, Sachandrakam Salilam Adhasravati, bleeding in with the feces can occur. ततो मांसधावन प्रकाशम उत्तरकालम दिवशोनितं च ततो बुधनिस्सरणं वेपतुः वमनात् योगोपद्रवश्च भवन्ति तमपि निःसृतशोणितविधानेन उपचरेत् निस्सर्पितबुधस्य बुधम् अभ्यद्य परिस्वेद्य अन्तःपीडयेत् क्षुद्ररोगचिकित्सितं वापीक्षेत वेपतुः वातव्याधिविधानं कुर्वेत जिह्वा निस्सरणादिषु उक्तप्रतीकारः अतिप्रवृत्ते वा दिवशोनिते काश्मीरीफलबदरी दूर्वा क्षीरैः श्रुतेन पयसा घृतमण्ड अञ्जनयुक्तेन सुशीतेन आस्थापयेत् निघ्नोदादिकषाय ईक्षुरस घृत शोणित संसृष्टेयनं बस्तिभिः उपाचरेत् शोणितस्तीवने रक्तपित्त रक्त अतिचारक्रियाश्चास्य विदद्यात् निग्रोधादिविचास्य विदद्यात् पानभोजनेषु. A similar village antioga also can result in bleeding as well as the bleeding. There again, initially it could be like blood with the discolored appearances, which is suggestive of a slow bleeding. Or if it can be a frank blood, Jivashonita can occur. That frank blood would be suggestive of a massive bleeding. Or there could be prolapse of the anus, and all the other complications like impaired consciousness in case of Vamanavirechnvyapat yoga may occur. And there again, the treatment protocol is Nishrita Shonita Vidhana, the protocol of treatment of massive bleeding. That's the treatment. Same as such, maybe it may be up to the level of blood transfusion. If there is a prolapse of the rectum, then it has to be pushed back, as in case of Kshudraroga Chikitsa, or Vatavyadhi Vidhana. Treatment with Vatavyadhi has to be followed there. And the other options in case of a massive bleeding could be you give the fruit juices of Kashmiri Phala, Badari Phala, etc. Or then Asthapana has to be given, or even Basti the other different bastis with the negrozhati kashaya, sambanasta, kashaya rasadraviyas, can be given, and negrozhati kashaya is always preferable for the internal administration as such. How to identify the Jivashonita, that the fresh blood? Jivashonita Raktapittayosh Jnasartham Tasmin Pitum Protomakshipeta यदि उष्णोदक प्रक्षालितमपि वस्त्रं रञ्जयति तज्जीवशोणितम् अवगन्तव्यं सभक्तं च शुने दद्यात् शक्तुसम्मिश्रं च स यदि उपभुञ्जीत तज्जीवशोणितम् अवगन्तव्यम् अन्यथा रक्तपित्तम् इति. Now whether the patient has a raktapitta, disease condition and abnormal blood flowing, or it is the normal blood which has resulted in the complications, to confirm that Sushruta suggests about two tests. One, if the patient has that bleeding with the feces, you put a cloth, piece of a cloth over that area and then wash it with warm water. If the color remains as such, color cannot be washed off with the warm water, then that is a Jivashvarta, normal blood. Now this is again bit controversy. In case of in Vagbhata, the lakshanas of the normal blood given is a yadvaso navirinjayet, where it doesn't retain, the color is not retained as a symptom in case of the normal blood. Whereas Sushruta says the other way, which keeps the stain. Now what we have observed now is, see, of course with the normal blood is better washable. See, hemoglobin, if it's not oxidized, it doesn't stain much and it can be washed off easily. But once it has become oxidized, hemoglobin has become oxidized, oxyhemoglobin or carboxyhemoglobin, which is exposed to the environment, then it's not washable. So what happens really will be, it is the time factor. If the blood stain has fallen on your cloth, if you wash it immediately, the stain can be washed off easily. If you wait for some 5 to 10 minutes, then the stain may remain for a longer duration. That's the real fact. So that test, like whether a stains cloth or not, which is mentioned in our Samhitas, that needs to be reviewed now. I am not saying that it is wrong or right, but the whole protocol has to be reviewed, standardizing that time factor, and then whether you use a soap or other or not. And it also depends upon the nature of the water. If it is a fresh water, of course the staining can be easily removed. If it is a hard water, then it's difficult. So those are all the many issues which are to be considered. So that test need to be standardized with the different options. So it's not to be taken, it cannot be taken directly and at its face value. Then another option given by Sushruta is you add that blood to some other eatable substance and give it to a dog. And if the dog consumes it, that's a normal blood. If the dog rejects it, then it's not normal blood. Now this again, animals do have a preference for the normal blood, that's true. How far this is practically true or not, again I don't know. Then sasheshanyena bhudoshena rukshena anilapraya postena anustam astigdam apitam aushadam adhnapayati tatra anila mutabrisha sangha samunnagdha udarata पार्श्वभङ्गः गुदबस्तिनिस्तोदनं भक्तारुचिश्च भवति तं च आध्वानं मिथ्याचक्षते तम् उपस्वेत्य आनाहबस्लीपनबस्तिक्रियाभिः उपचरेत्. The patient may have a retained food in the abdomen. Now this again is another of the complications which results in adhvana, distension of the abdomen, and the pain in the gudabasti, in the bladder as well as the rectum area, and improper appetite. And that again Sushruta says you have to give varti or deepanabasti, etc. But what I have observed is these kind of complications are quite frequent if the samsarjana krama is not followed. Then kshamena ati mrudukostena mandagnina rukshena va atitikshna atilavanam atiruksham va pitam aushadam pittanilo pradushya परिकर्तिका मापादेति तत्र गुदनाभि मेट्र बस्ति शिरस्सु सराहं परिकर्तनम् अनिलसंगो वायुविष्टम्भो भक्तारुचिश्च भवति तत्र पिच्छाबस्तिः यष्टि मधुक कृष्ण तिलकल्क मधुकृतयुक्तः शीतां परिषिक्तं जैनं पयसा भुक्तवन्तं घृतमण्डेन यष्टि मधुक सिद्धेन तैलेन वा अनुवासयेत्. Parikartika is the proctitis, inflammation of the anal mucosa, which can occur again due to the consumption of rukshahara or tikshna and patient would have pain, burning sensation in the anal area and improper appetite. The optimum treatment there is a pithabasti or madhuyasti kalka with grita and parisheka also can be given. Administering food with the milk and ghruta has to be administered, or madhyasti taila also can be given. क्रूरकोष्ठस्य अतिप्रभूतदोषस्य मृदौषधमुपचारितं समुत्कृष्य दोषान् न निःशेष्य अपहरति ततस्ते दोषाः परिस्रावम् आपादयन्ति तत्र दौर्बल्य उदरविष्टम्भ अरुचिगात्रसदनानि भवन्ति संवेदनो च अस्य पित्तश्लेष्माणो परिस्रवतः तं परिस्रावमित्याचक्षते तम् अजकर्ण धव तिनिश पलाश बलाकषायैः मधुसंयुक्तैः आस्थापयेत् उपशान्तदोषं स्निग्धं च भूयः संशोधयेत्. Now another of the complication which can occur is a parisrava, where due to the either kosta, krura kosta, or if the medicine given is a mridu aushadhi, it can result in a persistent discharges from the anus, leakage of the substances from the anus, a sort of incontinence which can occur. And the treatment along with the incontinence, that leakage, the patient may have the abdominal symptoms like impaired appetite and the distension of the abdomen, etc. And pain also can occur. And in such a conditions, the treatment is you have to give asthapana with the ajakarna dhava dinisha, etc. And then again, once the symptoms have recovered, you may have to give another course of vilechana. अतिरोक्षे अतिस्निग्धे वा भेषजम् उपचारितम् अप्राप्तं वातवृत्तः उदीर इति वेगाघातेन तदा प्रवाहिता भवति तत्र सवातं सदाहं सशूलं गुरुपिच्छिलं श्वेतं कृस्तं सरक्तं वा भृशं प्रवाहमाणः कफम् उपविशति तं परिस्रावविधानेन उपचरेत्. A pravahika is a similar condition, symptom, where the patient may have a griping pain and a mucus mixed stools would be flown out, and burning sensation also would occur. Or even blood stain stools may occur. That's colitis can occur as a complication. And there again, the treatment protocol is the same as that of the parisrava. Parisrava and the pravahika, the treatment protocol are the same. यस्तु ऊर्ध्वम् अधो वा भेषजवेगं प्रवृत्तम् अज्ञत्वाद् विनिहन्ति तस्य उपसरणं हृदि कुर्वन्ति दोषाः तत्र प्रधानमर्मसन्तापात् वेदनाभिः अत्यर्थं पीडमानो दन्तान् किटिकिटायते उद्गताक्षो जिह्वं खादति प्रताम्यति अचेतश्च भवति तं परिवर्तयन्ति मूर्खाः तम् अभ्यद्य धान्यस्वेदनं स्वेदयेत् यष्टिमधुकसिद्धेन च तैलेन अनुवासयेत् शिरविरचनित अस्मै तीक्ष्णं विदद्यात् ततो यष्टिमधुकमिश्रेण तण्डुलाम्बना छर्दयेत् यथा दोषत्रयेण चेनं बस्तिमिवाचरेत्. Occasionally, a patients who are given these drugs may present with a behavioral changes which mimics the seizures. Seizure-like activity would be presented, where the patient may have may fall down and may have that uncontrolled movement of the mouth, or even that could be injury to the tongue. So something like exactly the seizure-like activity could be presented. And Shruti says they are rejected or they are considered to be incurable by those who do not know, murkha. Only unintelligent people will reject such a patient. Instead, you have to treat with the svedana, dhanya svedana, and anuvasana with the yashtimadhuka taila, and shirovirachana has to be given, and then you may have to give a chardana, omana, with the tandulambra, with the rice water, or then you have to give basti according to those. यस्तु ऊर्ध्वम् अधो वा प्रवृत्तदोषः शीताकारम् उदकम् अनिलम् अन्यद्वा सेवेत तस्य दोषः स्रोतस्य अवदीयमानाः घनीभावमापन्नाः वातमूत्रशकृद्गृहम् आपाद्य विभद्यन्ते तस्य आटोपो दाहो ज्वरो वेदनाश्च तीव्राः भवति तमाशु वामयित्वा प्राप्तकालां क्रियां कुर्वीत अधोभागे तु अधोभागदोषद्रव्यं सैन्धव अम्लमूत्रसंश्लिष्टं विरेचनया पायेत् आस्थापनम् अनुवासनं यथा दोषं विदद्यात् यथा दोषम् आहारक्रमं च उभयतो भागे तु उपद्रवविशेषान् यथास्वं प्रतिकुर्वीत. After the shodhana, if the later samsarjana karma protocol is not followed, or if the patient gets exposed to the cold or consumes lots of cold water, such conditions, it results in the consolidation of the doshas in the abdomen, resulting in constipation or distension of the abdomen, burning sensation, fever, etc. Such conditions have to be treated with the Vamana or Virechana, again depending upon the previous indications. Astapana and Anuvasana also has to be given. That's about the protocol of the treatment. यात विरेचने गुदपरिका तद्वमने कंठक्षणनं यदधर परिश्रवणं च ऊर्ध्वभागश्लेषं प्रसेकः यात अधर प्रवाहिकः सार्थ ऊर्ध्व शुष्कोद्गारः इति. Now the parikartika in virechana may be presented as a contakshanana, injury to the throat in Vamana, and the incontinence that persists and discharges in virechana may be considered as a shlesham praseka, continuous salivation, persistent salivation in case of the Vamana. And patients who have that colitis like conditions may be presented as a persistent dry irritations in the Vamana. यास्तु एताः व्यापक प्रोक्ताः दश पञ्चतत्त्वतः एताः विरेक अतियोग दुर्योग योग अयोगजाः स्मृताः. These are the complications which can occur due to improper administration of the शोधन चिकित्सा. इति सुश्रुतसंहितायां चिकित्सास्थाने वमनविरेचनव्यापक चिकित्सा नाम चतुस्त्रिंशो अध्यायः. What I have observed in my clinical practice is most of these complications do occur due to improper samsarjana krama, and of course not following the protocols of the Snehana and Svedana. So more importance is given to the samsarjana krama otherwise. Then there is a question, if Vamana does not occur and instead Virechana occurs, then should we repeat Vamana on the same day? No. As per Sushrutas protocol, it is not that you have to repeat on the same day. You have to give some sufficient time gap and then it has to be given. Sushruta has mentioned as 10 days. Otherwise, it can be given for one paksha. In Bhagavata, it is mentioned as paksha. So 10 or 15 days gap has to be given, and then again the same protocol of Vamana has to be done. There again, either the Vamaka Dravya, the medicines which are given for Vamana, may be modified, changed as such as per the patient's condition. That's the issue, right? Okay. No other questions? Fine.